My name is Dr. Alina Dellanzo. I'm happy to be with you at Pritikan. I learned a lot here, and this is my second time like you came. My reason it's here and what I love, it's prevention. So my grandmother died of stroke, my grandfather died of diabetes, so my father has diabetes, cholesterol, high blood pressure. The reason I'm here because I don't want to have this. And I'm 47 years old, and I'm working hard. I gave up 6 months ago salt. I gave up on bread. I gave up on sugar this year. Not easy. Drinking, I go 2 times a week. I have a glass of wine or martini, basil, and that's it. Let's go back to the presentation. So we're going to present today oral disease and cardiovascular, and if it's any association. So I'm a foreign dentist. I came to the United States in 1990. I was 14 years old. I didn't speak English. I worked my way up. I did high school. I went back to Romania. I finished 6 years. It was not easy. During the summer, I was babysitter, housekeeper. My father told me, you need to work. I don't have money to support you. You have to come, do your education, because you do it for you. So in 2015, I bought 2 offices. I did all my education. I arrived to New York. I worked with Dr. Roger Gershon for 7 years. He's my best mentor. Actually, I'm here because of him. He came last year, and he gave up like 4 pills of high blood pressure. And he said, go to this center, you're going to love it, especially my husband is here, and he's 20 years older. And I said, I need to live well and happy. And working with him, I start my postgraduate programs. I've been to NYU. I did 1 year of aesthetics. So wherever I learned from him, I start working on the patients there. To get the degrees, you have to go to certain steps. So you have to get your accreditation, which is not easy. I went to Rochester. I did 2 years of AGD, Advanced Education in General Dentistry, 6 months of research. I've been to Albany, where I established. I did residency there. Then I fell an exam, and I went 2nd year of GPR. But the gut is pushing you in the right direction because of foreign and English, but was the best year that happened to me. After that, I bought my own office. Last year, I bought the 2nd one. And I'm doing a lot of continuing education. Actually, I registered to functional medicine. I'm doing a fellowship, so more. Last year in December, I went to cardiology 3 days. I'm doing this year in April, I'm coming endocrinology. Every 6 months, it's everything new. In December, I'm doing peptides, stem cells, epigenetics, genetics. I always love to learn and see what's going on in our body. Presentation outline, questions to ponder, introduction, literature review, what does the evidence tell us, how we're going to use it, and conclusion. Is there any association with cardiovascular disease? What do we know about the topic? What does the current literature tell us? So in oral cavity, I don't know if you know, the oral cavity is the more infection mouth in our body. We have over 700 bacteria. Viruses, candida, spirochetes, aerobic, anaerobic. I had a patient 4 months ago. He came with swelling on the mouth. First thing I ask, for how long is this swelling? 1 month. I sent to oral surgeon, end up 4 years old, cancer of the sinus. Why? What you doing? You are young. What do you eat? He told me I use headphones, so it's a lot of radiation. So now he's going to a lot of treatments, so a lot of things. Don't use the phone, close it in the evening. Computer next to you, TV, it's a lot of EMF. It's not healthy for us. So number 1 cause, cardiovascular disease. So look at this, high blood pressure. So high blood pressure, cholesterol, diabetes. And if you have gum disease, and all of this, it's affecting. No matter you take the pills, if you don't fix the cause and the root cause where it's starting and where it does it start, in our mouth. You cannot take non-stop pills, because pills, you take pills for diabetes, it's going to affect, in the future, you're going to have Alzheimer's. You take for high blood pressure, you're going to have a stroke or heart attack. Why? We need to love ourselves and to say, I need to stop this. We eat non-stop, we eat non-stop. Behavior, I'm trying to help my patients how much I can. And if you see me 4 years back, I look like a grandmother. And I'm looking, I went to this all-inclusive. I eat Roman pineapple, sweets, this. So what's happened? I discovered that I have problem in my stomach because you eat impulsive. So gut is connection with the brain. I learned here that you have to fix the brain first. So I connect all the dots and I'm trying and to learn. Second, diabetes. My father has diabetes. My grandfather died of diabetes. If he was here, he wouldn't die. So I love to help people and to not have, because diabetes, let's say you lose 2, 3, 4, 5 teeth. The research said if you lose 7 teeth, you're going to have diabetes 100%. And diabetes is going to go to cardiovascular disease. 48% we have problem with gums less than 50 years old. Over 50, 70% they have problem with periodontal. And the dentist, they don't tell you. You have to go every 90 to 120 days. We don't go for financial problem, or the dentist doesn't tell you. But it's not. If you have inflammation and bleeding, you have to get rid of. Again, periodontal disease, heart attack and stroke. Let's say I have a patient with periodontal disease. I put him in a protocol. First, I clean him, I scale him. I do a perio protect trace, the bleaching to stop the disease. At the beginning, I might do an oral DNA test. I want to see what kind of bacteria you have in your mouth. And that bacteria is related to your heart, to prostate, to colon cancer. So we have red species, you have green species, and you have blue species. So everything is correlated. I don't know if you know all of this, but I just wanted to learn and investigate because it will help you in the future. You're going to make your own diagnosis. I have this problem, I have this pain. Every tooth is connected with our body, and I will show you. So this is what happened with how much we pay for diabetes, for how we can prevent. So oral biofilm, again, look at this, how many disease here. Heart attacks, colorectal, Alzheimer, diabetes is related to Alzheimer, respiratory, adverse people, if they are pregnant, you need to go. You have gingivitis of pregnancy. You need to go for cleaning, because if not, you're going to give a premature baby. Some people, they don't know. So this is what happened in cardiovascular. So last year when I came with my husband, older people, they try to have no bleeding but chronic inflammation in the mouth. But it's good and bad. Then I send them to do a plaque score here. So you need to measure. If you have problem in the mouth, you need to do this carotid artery, which they do here. That's why I offer to teach here. I said, everything starts in the mouth and we don't know. So I want to teach the people what you have to do. So when I have a patient with periodontal disease, I send them to cardiologist to do. Or patient for hip replacement, open heart surgery. Let's say example, I bought an office last year, 1 year ago. I have a patient with wisdom tooth. Wisdom teeth affecting your heart. So he came, and thanks God, I asked for medical history. So any medical, oh yes, I had an open heart surgery last year. So how come your cardiologist didn't send to me to have a clearance? So now I have to call the cardiology, losing my time. Second, I cannot extract the tooth. 1 year you cannot touch because you're going to get inflammation in the valves. And the third one, I put you on antibiotic. How much antibiotics can you take? Antibiotics, they're not healthy. Maybe you think they are, but they are not. So that meant 1 year we couldn't do the extraction. So why? Because hip replacement, oncologist, cardiologist, you need clearance, because then you have to take all the time antibiotics when you see a dentist, and you cannot do the work. So this is the test that I was talking about. You can do a lot of tests in saliva and see what kind of bacteria, and will help us to, sometimes you need antibiotics for periodontal disease. So all of this, what I show you, I have it in the front of the patient. I have this board here, and I explain to them. You have high blood pressure. What do you do? You have infection on a tooth. So this is periodontal disease. Actually, I'm missing one, endodontist. So everything where is going? To the body. This is all inflammation. So how do we measure this? We can prevent all of this. Yeah, so this is Bell-Donin method that I'm a member of them. They are in Washington, and they are prevention for heart attack and stroke. It's more investigation of tests. I don't have this kind of patients to pay $2,500 and do all of this, and they do all the root cause. But I'm learning every month. I listen to them, and they talk about one test and what you can advise the patient. What do they do? It's a good membership that I'm learning. It's more medicine actually. So this is a nice example. So this is number 29. You see this infection here came abscess like this. So what do? You give them choice. You give them root canal. You give them extraction. So it's where it's black there, it's a cavity into the nerve. So the nerve died. There is no nerve there. The tooth, it's non-vital. So when the tooth is non-vital in our body, it's no energy. So where is this tooth related? Here it is, esophagus and pancreas. So I know this person very well, and she's complaining for 4 months, I have problem with my stomach, I have problem with my stomach. I said, I see what you're eating, it's bad what you're eating, you have to change. No, it's not. And then she came swelling, and I took an x-ray, and then I related to her, she has esophagus problem. So when I'm going back, I'm gonna extract that tooth. She doesn't want root canal, she doesn't believe. So in Europe, people, they don't believe in root canals. So here is different. But it's every tooth of the body. If you have pain somewhere, it's related to our body with any organ, wisdom teeth, with heart. So every tooth, you can Google meridians of the mouth related in the teeth, and you will see everything. If you have a problem, you know how to diagnose yourself. So we have gum disease. So this is all the ligaments. And this is the bone. So why a tooth, the nerve die, why we extract it? From 3 reasons. 1, when you go to the dentist, you have pain. So it's a cavity. 2nd, it's the deep cavity or the nerve die. 2nd, it's periodontal disease. So you lost the bone from here through here. So what do? You do surgery, you do root canal. So this is the 2nd cause, periodontal disease. And 3rd, it's abscess. These are the 3 reasons that you can lose a teeth. So abscess you develop here, where everything is going to the small vessel and transfer to the heart and all over the body. So this is stages of periodontal, healthy gingivitis, periodontal pockets, and this is where the problem and recede. So why I choose this? So I want to know who's using these flossers, plastic flossers that you cut. How many people use this? Okay, majority. Okay, so when you go to the dentist, do the hygienists give you a mirror? This is how I want you to floss? No. I know. Yours? Okay, do you use this?
I use the regular.
Perfect, you are, okay. So this is the floss. Let's go back and I will finish. I don't want to interrupt. So this is where the inflammation comes. So you see this, all of those, you can do it in the mouth with the test with oral DNA, or there are different companies. I don't care what you're using. Or you can do it on the blood. So I used to take an insurance that I did oral DNA, they didn't want to pay. So I said, look, if you don't allow me to do medical or dental and the patient pay, I'm not going to work with you, and I gave up. I said, I cannot practice dentistry if you don't allow me, or medical or dental. The patient had heart attack in the family, both mother and father, and I would like to do this test. What's the problem with this? And they said, no, because you couldn't do it on a blood with $8. I said, first I didn't know that exists in the blood, and then I researched, but at the moment I did a test just to save a life of a person. Let me do my work. They said, no, okay, so I give up on insurance, I'm okay. But at least I feel good, and I take the money back, and I did all the work what I have to do to the patient. But it was upsetting. Periodontal disease also linked to diabetes, renal, pregnancy, like we said this already. So look at this, how it's dental disease and where it's going, again, to the arteries and heart. So immune response, look at this, all of this lipidemia, endothelial, inflammation, all of the diabetes, smoking, diet, obstructing. So all of this is all together related. So how do the periodontal disease spread to the cardiovascular? Through the small vessels from inflammations, where is the tooth support the structure. So this is the literature how, with one of my colleagues, we choose the best articles for poor oral health and blood pressure control among the hypertensive. So what's the conclusion? So we take pills all day long, but if you don't help the oral inflammation, you're not gonna have good results. So here is what it says: the blood pressure interfering with hypertension medicine. So if you don't help yourself with the gum disease and cure, you can take so many pills. So you understand what I'm saying? You need to have proper treatment in the mouth. Pills is not, it's gonna buy you time, it's like a patching. Correct? We need to help the problem. So this is, again, the oral health and atherosclerotic. So they are common pathophysiological. They need more research a little bit, but I know for sure, especially the last 2 years, patients are inflamed in the mouth. You cannot imagine. There are good papers. So this is the co-founder about the risk factors. So conclusion, if we're missing teeth, we're gonna have diabetes and cardiovascular problem. So number one. So we need to keep our teeth healthy. Not for periodontal disease, not from cavities, not from abscesses to extract them. So also this is for heart, mitochondrial dysfunction, promote the PG. So there are a lot of bacteria with names, and we can test them. And it's not, inflammation is there all over if you don't take care of the cause. So in conclusion, oral hygiene, you need to implement and to tell to the hygienist, please give me a mirror, show me how to do. Some of the people, they don't want to do their work. I have 2 hygienists, and I'm working on them. I said, you're spending too much little time. So number 1, this is, you keep the floss here, and this is how you do, and you go between the teeth. You never do like this. So this one, the, how you call this, plackers. So look what you're doing all day long. You're cutting your gum. You understand? I have patients with recessions, the gum recede, and pain every week. 3 at least. And nothing wrong with the teeth. Nothing wrong. And I tell them, show me how you flow. Oh, I'm not using this. I'm using this. So when I walk into the room to do exam, so how are you? Nice to meet you. Here's, oh, I'm not using this floss. So I tell to my hygienist, please do the right thing. I don't like laziness. I like to do a thorough exam. Because if you fix this, you fix that problem with the gums and inflammation. Second, anybody clean the tongue in the morning? Clean it. You will see, you cannot imagine what is white pellicle in the morning. Actually, I clean 2 times a day, in the morning and in the night. Very important. Rinsing, don't use Listerine. Listerine cut all the good bacteria. Actually, Mark Houston from Tennessee, I went in December for cardiac. Listerine is killer. They kill the good bacteria. And guess what? You have problems with the stomach. Yeah. You know? This is a tongue cleaner. Tongue cleaner that you clean your tongue. Tongue, yes. And then, let's say you have gum disease, chronic, or you have spaces. There are brushes. It's called tepe. Buy them online. And you clean the most important thing to not develop cavities, it's to remove the plaque. Super floss doesn't remove the plaque. You need to do floss. In the morning, in the night, I don't care. I like it in the night, actually, because you will eat, and then you clean with the floss. So in the nighttime, you're doing each tooth individual. You clean and you take it out like this. Don't do it like this, cut your gums. Recede and pain, and it's gonna cost you, the periodontist, $1,500 for each tooth to do connective tissue. Surgeries are expensive. So you clean your tongue, you do your flossing. You wanna do super floss? Yes, you can do it. But I advise you to not put, you have to use more healthy stuff. I'm using Stella Life, doesn't matter what. Actually, I'm gonna give to everyone, I like ozone. So it's oil, and they do with these brushes, and I have good results. Ozone is not FDA approved, but works. I'm using for 2 years, all over, in my mouth, in the body, in the face, everything. It helps. And it's a small oil, actually, it's oxygen. What else I wanna tell you? So the brushes. In conclusion, oral hygiene is the most, go to the dentist to check for oral cancer. We have a lot of HPV, younger generation, even older. So when it's HPV, you find it when it's too advanced. So oral cancer, it's short, it's like 5 years if you develop oral cancer. So it's not, you need to do oral exam. So check your mouth if you have any red lesion, white lesion, smoking. I hope no one smokes here. I'm against smoking. Tell me.
When you say clean your tongue,
yes.
Do you use your toothbrush?
I don't think so. We'll go out. No, you need, it's a tank. You go to the supermarkets and they have exactly like this, and you clean it, and you will see what is there. Everything is white, all the bacteria.
And then I have another question.
Yes.
What do you think about toothpaste with fluoride? What do you think about fluoride?
They don't like fluoride. They don't like for thyroid. I don't use it because I'm a biologic dentist. They don't like xylitol is good. They don't like heavy metals, the cardiologist said. They don't like Coca-Cola. One Coca-Cola, what it's doing to your body, I couldn't believe. He was talking for 3 hours from a glass of Coca-Cola, what it's doing to our body. High blood pressure, they said pomegranate, eat every day, will help you with blood pressure. Of course, exercise, oatmeal in the morning, sleep 8 hours a night, 7, 8 hours, take a nap afternoon, older people. Exercise, he said 7 days a week. So inflammation, share a lot with cardiovascular and add other things. Like I saw patients with prostate cancer, unbelievable in the mouth, inflammation. There are some breast cancer, with everything, all the, because their breast, it's closed, so everything is going from the mouth, will go to the breast. So I ask, do you do GYN? Do you do mammogram? Because the first cancer from the mouth is going to the breast, the lymph nodes. Tell me.
What mouthwash do you recommend?
To tell you the truth, I don't use. Your mouth shouldn't smell. I put water. Sometimes if I tell you what, you're not going to do it. I put cayenne pepper. I have a solution and I put cayenne pepper. Or it's a company in Belgium, Unda, and I just discover, I don't use too many chemicals in my mouth. I don't want to. Because what I learned from all of these conferences, it's affecting our gut. Everybody Listerine, why you taking that alcohol? And it's not healthy. I couldn't believe that he said, and I knew alcohol is not, the Listerine has a lot of alcohol. I don't use too much. And actually I use from this company, they have oil pulling. And I rinse with that and I keep it in my mouth 10 minutes. And it's detoxing, it's absorbing everything. So I like alternative stuff. I don't like chemicals. But you Google it, they have a lot of stuff there. I'm not member, I just love the product. And I use in my office, I have ozone, I do irrigation with water. Wherever you are, Google, the ozone helps. It's oxygen, doesn't harm you. Actually, I cement 10 crowns, and was a little purple, you know, a little sensitivity. I did irrigation 2 minutes, the purple went away immediately. I couldn't believe. So, and no pain, no sensitivity. Ozone, some people like it, some people no, but I use it for 2 years in my patients. When I stay home 3 months for COVID, I investigate what is in Europe, what they use, Germany, Switzerland. So I did whatever they did there, and works in my office. So this is my boy here, my ring boy, who left us 3 days ago. He's supposed to be with us. So it's my husband dog. And I bring him here together. And also this presentation was for my grandmother that died of stroke and my grandfather of diabetes. So what can I say? Enjoy your life, love yourself more, and work on your hygiene and our health and lifestyle. It's not easy, but I did it. We need to put our brain. I have a patient who smokes, and I said, look, you're gonna go home, and you talk to yourself when you wanna take a cigarette, and you talk hard, and I say, I wanna stop smoking, I wanna stop smoking. And reduce 1 cigarette for me. So I make 5 patients in my life that they stop, you know. I'm trying my best, you know. Any questions for me? So I don't know if your dentist know about oral DNA, if you have bacteria in the mouth. Google it, and you can go, listen, I want to do this test. Yes, cost 200, 250. I'm not sure if insurance pay. When I treat a patient, I don't care about the money. If it doesn't have money, I will give it for free. I don't care. I'm very sensitive for my grandparents. Sometimes I lose money, sometimes I gain. But, you know, I'm happy that every day I have 5 new patients. What? Yes, you can give it. Any questions? So now you know when you have pain in your tooth, don't go and jump. If you have an older dentist, some older dentists, they don't know the new technology. They don't know. I have a patient last week. Did I explain with the stroke? The patient? No. So he came to me new, 71 stroke. And I'm taking the x-ray, he has infections all over, crowns all over, root canals all over. Why? 7 years I never had redo a cavity, I never do a crown, I'm against root canals. Why in this man he had a stroke? And undiagnosed root canals, and he had the stroke. So I'm comparing the x-rays. And I said, when was the last time you went to the dentist? November. So they took half of the x-ray, not the integral tooth. So you don't see the infections. So I can see this. Or you do, I learned from my mom. I grew up in communist country. It was like this or it was like this. My mom would write me every day. You have to do cleaning today, you have to iron, you have to cook, you have to wash. So when you do things in your life, you have to do it with love and care, and don't do superficial because it's not gonna work. We're gonna go in America. You need to do it right to not fail. So this is why I'm doing right. Yeah, this is the best.